Daniel Bonine, welcome to 9 on 9, our weekly in-depth interview show. This week we are getting a progress report on COVID-19 in El Paso. I recently got a chance to speak with Dr. Ogechika Alozie, a local infectious disease expert. We talked about the Delta variant, what it means for both vaccinated and unvaccinated people. We talked about booster shots, and we talked about back-to-school concerns. Let's go ahead and get started. 9 on 9 starts right now. All right, Dr. Alozie, thank you so much for being with us. As always, I'm going to start off with a question that I hear a lot. I find myself wondering, so with this Delta variant out there, very contagious, highly contagious, if you are vaccinated, how concerned should you be? Should you still be wearing a mask?
Yeah, I think my top line sort of headline there is if you're fully vaccinated, 2 mRNA shots 2 weeks later, or 1 Johnson & Johnson 2 weeks later, your concern should be close to zero. Now, I say that and people say, well, what about if I'm immune compromised and if I'm old? I get it. But on average, if you're not what I'd call frail or medically compromised, on average, you don't have a lot of risk. For those subpopulations that are, a little bit different. I think we can talk about that later as well.
From what you understand, how is the Delta variant looking in El Paso right now? Is it pretty widespread from what you know?
As of last week, in talking to the public health authorities, we had not actually identified any Delta variant in the surveillance testing, so that's a good thing. I mean, the expectation is that it will ramp up over the summer and into the fall. But again, I think the important thing here is, where are you? We live in El Paso, where almost 92% of over 65 have been vaccinated. Close to 80% of above 12-year-olds have been vaccinated. And so the number of people that can actually catch coronavirus is dwindling rapidly.
Tell us about how we identify variants. How do we know that these come up?
Yeah, it's PCR cycle testing. You do deep antigen testing, and you really identify the sequences in the PCR, and that tells us whether it's the 1617.1, the 1617.2, a lot of numbers that people really don't want or need to know. But I think whether it's alpha, delta, gamma, lambda, here's the answer. Get vaccinated.
So we do hear that this Delta variant is highly contagious. What's different about it? What makes it so highly contagious?
Well, I think the most or more important part is this. When we say it's highly contagious, let's make an assumption that the original coronavirus strain was about 10% contagious, right? So you had a 10% chance unmasked around somebody with coronavirus. So even if this is 60% or 100% more contagious, your risk is either 16 or 20% around somebody that has active COVID. So you have to make a decision. Is 16 to 20% actually what I'm going to change my whole life around? Some people will say yes, other people will say no. I think more importantly, if you're vaccinated, you've reduced that risk by 90%, so it's less than 1%. A lot of numbers thrown out there, but I think, and I didn't really answer your question about what makes it more contagious, but I think those are some of the numbers that people have to think about as we sort of decide what to do in our lives.
When it comes to the Delta, do the symptoms present differently?
No, so I mean the virus is the virus, right? And so people have what's called upper respiratory symptoms, sort of cough, runny nose. Some people have fever. Again, loss of taste, loss of smell. Some people actually have increased heart rate, right? Some people have diarrhea. There's a host of different things that it can present as. What I tell people, if you feel sick, go get tested, just to know. Now, if you're vaccinated, we can have an argument about whether you need to get tested or not, but I think that's really what it boils down to.
I have it here that we're also tracking a Delta Plus variant that appears to attack the lung cells. Can you tell us a little bit about that, what you know about that?
Totally. A little bit too early. And I think one thing that has happened throughout what I call the COVID fear porn news cycle, right, we're all sort of caught up in it, is that we get a singular report. And that report says the sky is falling, that the vaccines only work 10% of the time. And then all of a sudden we get 10 more reports that are much better done, more studied, and they tell us no, these vaccines actually work. So the Delta Plus you're talking about, there does seem to be some vaccine escape, as it's called, but I think it's still too early. The key thing is this: if you're not vaccinated, get vaccinated. Let scientists and the science worry about what happens into the fall. I just don't think we're there yet, and it's just July. You have a lot of the summer to enjoy.
Yeah, so what are you telling people who are still hesitant to get vaccinated?
I try to have a conversation, and I think it has to be an open and honest conversation, and ask them why not. I can actually understand a 30-year-old that's completely healthy telling me, hey, I feel good. The community spread is probably less than 2 cases in 100,000. I don't work in an area where I come in contact. I try to wear a mask intermittently, and that's a fair argument. Now, obviously, as an infectious disease physician, a public health person, I try to tell them, hey, not just for them, but potentially for their family. But I think we need to get away from either scaring people about vaccines or shaming them about vaccines. That hasn't worked. And again, it's important to remember, at the percentages that we are with vaccinations, also remembering a large percentage of our community already had COVID. They have what's called natural immunity. We are probably well above herd immunity, and that's why we're seeing those cases kind of stabilize to flatline.
So I guess at this point, anyone who wants a vaccine can just easily get one. We're at that point in time, thankfully. So a lot of people are saying, well, if you didn't get the vaccine and you don't want to get it, then that's kind of on you, and it's up to you to protect yourself. What are your thoughts on that, kind of the bigger scheme of just getting everybody vaccinated?
Yeah, I mean, I think the analogy is smoking, right? We don't mandate whether people smoke or not. They're allowed to walk into any store, gas station, or anywhere else and get a cigarette or get a cigar. And at some point in time, and I think we may be really close to that in El Paso, if you've made a conscious decision or haven't been able to get vaccinated because of your own deliberate decision, I think it is what it is. We cannot continue forever to continue to have this paralysis of fear around 5% or 10% or 15%. I understand people that don't want to get vaccinated, and I don't shame them. That's their personal decision.
All right, we got to take a quick break. We are just getting started here on 9 on 9 this evening. Still got a lot to talk about. I want to talk about boosters. I want to talk about vaccines for the younger children. Stay with us.